Alrighty, so this module we're going to talk about the impact on occupational performance for individuals with feeding and eating disorders. So, really, to varying extents, all aspects of daily life are negatively impacted by an eating disorder due to the decreased energy as a result of limited nutritional intake, as well as increased discomfort and stress as a result of the sensory aspects of certain foods, such as smells. Individuals with eating disorders may experience increased isolation and decreased engagement in occupation, such as school, work, or leisure. So, this is an all encompassing a disorder that can have an impact in all domains within our occupational therapy practice framework. So, to start with ADLs, the ability to care for oneself is one area that's impaired by an eating disorder. Due to food restriction, feeding and swallowing are negatively impacted. Malnutrition may occur and require alternate methods of feeding, such as through placement of a nasogastric tube or an NG tube, or more invasive surgically placed tubes into the stomach or into the small intestine. So you can see that is a huge area of impact on occupational performance. Personal hygiene and grooming may also be impacted due to an increased focus on physical appearance. And if you think about, even from the perspective of the genitourinary system and how malnutrition can impact menses and the ability to manage all of that as well. So in terms of IADLs, eating disorders, especially anorexia nervosa, can lead to a singular focus on food to the exclusion of all else in daily life. So this may impact the ability to effectively care for others, including children, attend to home management responsibilities, including but not limited to meal prep and grocery shopping. If there's a food avoidance, those areas are going to be really, really challenging. And there might be, with those with longstanding eating disorders, some impairments due to cognitive deficits. Lack of nutrition can certainly impact how we are functioning cognitively. I think many of us can speak to when we're hungry or when we've not eaten something super nutritious. It definitely impacts, we feel that fatigue very quickly, which can impact our cognition. Safety and emergency maintenance are also a concern due to these potential cognitive impairments. And due to alterations in their belief system, the belief system in that using food as a way to control whatever is uncontrollable to them. These individuals do not recognize the health concerns associated with their restricted eating, and injuries may occur as a result of changes in body functions, such as decreased bone density, which really puts them at a higher risk for bone fractures. Health management is certainly a huge area that has a huge impact on occupational performance. Individuals with eating disorders do not adequately attend to their nutritional needs and have decreased awareness of the impact of food restriction on their overall physical and mental health. Malnutrition is the greatest concern in individuals with eating disorders. Other medical conditions associated with eating disorders include esophagitis, hypotension, dysrhythmias, esophageal reflux disorder, so your GERDs. Dental issues are a common issue with individuals with eating disorders, specifically bulimia nervosa or the rumination disorders due to self-induced vomiting or regurgitation. As I said earlier, obstetric and gynecological issues may also arise in this population, including but not limited to infertility, increased risk of miscarriage, and due to poor nutritional intake during pregnancy, potentially, there is an increased risk of neuro and chromosomal abnormalities in the baby. So this is a huge overarching condition that really impacts all areas. And you might see individuals with eating disorders, they have mental health issues. So I feel like that goes without saying, but you definitely will see such as anxiety, depression, obsessive compulsive disorder, also known as OCD, maybe a personality disorder. We might see individuals having those overlaying conditions of mental health as well as the feeding and eating disorder. The most serious mental health concern related to eating disorders is an increased risk of suicide or self-harm, especially in individuals with anorexia nervosa. So education and work certainly are going to be impacted. They might demonstrate lower performance and are at greater risk for failure within academia and within the workplace. This is due to client factors, performance patterns, and performance skill deficits. There might be a level of perfectionism and high work ethic associated with eating disorders, which is really interesting. And this could lead to the belief that they're not excelling and therefore just not doing as well. And the excessive focus on food, oftentimes accompanied by those cognitive deficits and decreased concentration resulting from decreased nutritional intake, continue to further the impact on academic and work performance. And if we think about play, leisure, and social participation, it's not uncommon for individuals with eating disorders to lose sight of what they do or did not find fun and important. So they may spend time excessively exercising or on other behaviors of thinking about restricting their eating. And all of this really negatively impacts their ability to effectively engage with others. It might have a negative impact on family relationships. Meal times can be a really, hard time for the families for children and adolescents with eating disorders. The need for constant prompting to eat can lead to increased fighting and inversely create, just a lot of tension within the home. The family may become consumed by the eating disorder and the impact it has on the child or the loved one, the adult loved one, resulting in limitations in overall, again, social participation. Increasingly, we're seeing people with eating disorders turning to social media to develop friendships and support, and these relationships can provide further negative reinforcement of eating disorders by allowing for comparison of eating behaviors, appearance. There's an increase in fat talk, which has been found to increase eating disorder behaviors as well. So, we're seeing all of these layers of diagnoses that you've been learning about so far this semester. And if we think about feeding and eating disorder that might have started secondary to sensory processing disorder with the food aversions, and then that food aversion turns into limiting food intake or purging and binging and purging, on top of maybe ADHD, on top of XY, now there might be a mental health component. So you see all of these conditions are layered on top of each other, but it's important for us to be able to kind of tease out those specific areas of occupational performance that we are then able to effectively address with these clients. So as always, if you have questions, don't hesitate to reach out.